A study about Regeneten was recently published in the CORR clinical journal, and it stated that Regeneten had no clinical benefits. What did the paper actually look at, and what were some of the things that we noticed that they did? So this is a level 3 study done out of Johns Hopkins Hospital in Baltimore, and it was a retrospective study, which basically means they analysed data and patterns of old cases they did and put it together in a clinical paper. They focused on patients that had rotator cuff tears, that had partial thickness tears, small to medium-sized full thickness tears, and large and massive rotator cuff tears. They were split into two different groups. The first group, which was the control, had patients for partial thickness tears and small full thickness tears receive a 1 anchor repair. Anything that was a large or massive full thickness tear had a double row repair. The other group had the exact same treatment repairs as the control group, but had a Regeneten put on top of it. The postoperative care for both groups was the exact same. Partial thickness and small to medium-sized full thickness tears were in a sling for 4 weeks. Large and massive full thickness tears were in a sling for 6 weeks. At 2 years, they followed up with every single one of those patients that were eligible. And what they looked at was stiffness rates and the reoperation rates for each of the patients that received the treatment. And the results showed that the patients that were in the control group, which are 94, none of them had a reoperation. But the group that had Regeneten, 4 out of the 47 patients had to have a reoperation for extreme stiffness. It also showed that a high number of patients in both groups had an injection of a steroid and also had a really high percentage that were steroids taken for pain management. When it came to the 4 patients that needed a reoperation, 3 of them were partial thickness tears and 1 was a massive full thickness rotator cuff tear. The first thing mentioned on the paper was that all the patients had completely healed tendons. The second thing is, out of the patients that had a partial thickness tear, we would recommend with Regeneten for partial thickness tears that it's used on its own. But in this study, they actually did a transosseous tendon repair and used 1 anchor and put Regeneten on top of it, which goes against what we suggest. The second thing is, partial thickness tears, when they don't get moving quickly after surgery, have a way higher chance of having stiffness. And because this partial thickness tear, those 3 patients, didn't get moving quickly and kept in a sling for 4 weeks, the chances of stiffness was going to increase dramatically when you use Regeneten, because it completely goes against the rehabilitation guidelines that we make sure doctors follow when it comes to using Regeneten. The third thing was that in the massive tear that had to come back for a revision operation, the patient actually had completely healed tendon, which is a massive positive, because the massive tears have a really high reoperation rate, and stiffness is actually a good thing when it comes to healing of these types of tears. And when you look at all the other studies, the ones that had stiffness previously and that were published, and the ones that had little to no stiffness, the same thing is brought up. The patients need to follow the rehabilitation guidelines and protocols when it comes to using Regeneten. If they don't, like the easel paper, like this one, you're going to get a lot more stiffness, which leads to more likelihood of complication. And in the chart, you can actually see the different stiffness percentages that are associated to the ones at the top, which have not followed the rehabilitation guidelines, and the ones at the bottom that have specifically followed the Regeneten rehabilitation guidelines. And also, you can see that the doctor that actually created this paper made a statement saying that Regeneten has no clinical benefit to any patient, and also that it should not be used until further evidence is collected to actually see or compare it and contrast it to the standard of care. But as we know, we have over 20 clinical papers that have been published with positive results, and also have 2 level 1 papers that compare it to the standard of care and had phenomenal results.